Hello, awesome staff of the Northwest Kidney Center with a shout out to the flagship unit in Kent, which of course is a beacon of light in the dialysis world. Today we're going to talk about mental health illness among dialysis patients. Now, psychiatric illness is common among dialysis patients. It includes anxiety disorders, depression, cognitive impairment, including like dementia, delirium, schizophrenia, suicide, substance abuse disorders, among others. And there is a significant clinical impact that mental health disorders has on dialysis patients. It affects compliance, it affects executive function, behavior. So this is an important issue for us to talk about. In advance, I want to recognize and appreciate all of you for helping our patients cope with mental illness. In particular, I want to thank our social workers who often had to deal with the consequences of behavior that stems from mental illness, potentially ranging from violence to homelessness and poverty. Now, the elephant in the room of mental health disorders is depression, but I'm going to save this topic specifically for a separate in-service because it's so important. So today I will focus on mental health disorders other than depression, specifically anxiety as well as neurocognitive disorders. There are three objectives to today's talk. One, I want you to understand the types and prevalence of psychiatric illness among dialysis patients, recognize their clinical presentation, and finally, review the adverse impact of mental health disorders on dialysis patients. Let's begin with an overview of mental health disorders that are common in dialysis patients. There are many common mental health disorders that we see in the dialysis population. As I mentioned earlier, depression is number one, is probably the most important, but we're not going to focus on that today. Anxiety disorders, and there are several types. Generalized anxiety disorder, panic disorder, there's something called agoraphobia, basically fear of being in public places. There are neurocognitive disorders, cognitive impairment, dementia, delirium. Psychotic disorders, the most common of which is schizophrenia, and substance-related and addictive disorders. Mental health disorders are common in the dialysis population. One study, for example, by Cougar, published in 2007, was a prospective study of 70 dialysis patients, mean age 53 years, who were assessed for psychiatric disorders, and the prevalence of any psychiatric diagnosis was 71%, which is much higher than in the general population. Another review by Fisher looked at the prevalence of depression, dementia, and substance-related disorders and found that it to be much greater in the dialysis population than in the general population. Of course, mental health disorders can have a significant negative impact on the performance of our patients. For example, it can contribute to poor compliance with dialysis. A study by Weisbord in 2014 found that depressive symptoms were independently associated with missed dialysis treatments as well as abbreviated dialysis sessions. Can lead to disruptive behavior in dialysis units, and I think all of us have seen this. Can also increase the risk of hospitalization. So there's a large database study published in 2019 by an author named Kimmel, who looked at basically chronic kidney disease patients that had just progressed to needing dialysis and followed them for their first year during the treatment, and basically looked at those who had a psychiatric diagnosis or a non-psychiatric diagnosis during subsequent hospitalizations. What they found among those ages 22 to 64, that 2% of the hospitalizations were for primary psychiatric disorders, and there was a psychiatric diagnosis that was a secondary diagnosis among a quarter of hospitalizations. Among those 65 or above in age, 2% of the hospitalizations were for a primary mental health disorder, and 19% of hospitalizations included a secondary psychiatric diagnosis. And these diagnoses most commonly included depression, and as I mentioned earlier, neurocognitive disorders such as delirium and dementia, and substance-related disorders. Having a mental health disorder also increases mortality. So the same large database study that we discussed above found that those who had mental health disorder had nearly 30% greater mortality than those who did not. And finally, other studies have shown an association between the presence of psychiatric disorders in dialysis patients and suicide, and we'll talk about that more later. Unfortunately, psychiatric disorders among dialysis patients are often underdiagnosed. And one reason may be that the symptoms of psychiatric disorders often overlap with the symptoms of inadequate dialysis or complications of dialysis or medication adverse events. Symptoms to watch for or signs to watch for include like a change in appearance, like if they were previously well groomed and now they are disheveled. That's often a sign of depression or a mental health disorder. If they have disproportionate anxiety, for example, with needle placement, they hyperventilate, they get super anxious about the whole process. If they're confused, they say comments that don't make any sense. If they see or hear things that aren't there, and of course, if they offer any suggestions of self-harm. Psychiatric disorders are also usually undertreated in the dialysis population. Now, there are a lot of medications we have to treat mental health disorders. I'm not going to specifically go through the antidepressants and antipsychotics that we have, but I do want you to remember that these have a lot of common side effects. For example, you may have observed some dialysis patients demonstrating uncontrolled jerking of the arms and legs. These are common side effects of psychiatric medications. They can also interfere with the electrical conduction to the heart by prolonging something called the QT interval, and this can increase the risk of arrhythmia or sudden death. Ideally, it's good to have patients with a psychiatric illness be followed by a mental health professional, such as a psychiatrist, although the latter are in short supply and most of our patients do not have access to one. Let's now take a moment to focus on anxiety disorders. So as I mentioned earlier, there are several different types of anxiety disorder. These include generalized anxiety disorder, panic disorder, or something called agoraphobia, or fear of being in public places. Based on prospective cross-sectional observational studies, anxiety disorders usually occur in up to 20 to 45% of maintenance dialysis patients. Interestingly, previous studies have failed to identify obvious triggers in this population. Now, there was one study, for example, that looked at 70 dialysis patients, followed them for anxiety disorders, and they found that they were very common. 46% of the patients had anxiety disorders, and 16% had both anxiety and depression. But the usual factors were not associated with the prevalence, such as socio-demographic stresses and various clinical factors. Symptoms of anxiety disorders may include fatigue. Signs may include impaired concentration, and common physical manifestations can include shortness of breath, sensation that your heart is pounding, and various gastrointestinal symptoms such as diarrhea or nausea. These symptoms tend not to improve over time. It's not like you kind of get used to dialysis and then everything calms down. There was a prospective study published in 2019 of patients who were started on dialysis and followed for a median of 20 months. And they monitored their symptoms with questionnaires. And basically, 24% of these patients, so a quarter of the patients, had clinically significant anxiety, but this did not improve throughout the first year of follow-up, did not get better with dialysis. Anxiety disorders in dialysis patients are associated with reduced quality of life. Additionally, dialysis patients with anxiety have increased risk for hospitalization and, interestingly, increased mortality as well. There was a study published in 2019 that used a self-reported questionnaire to assess patients for anxiety symptoms who were receiving dialysis. The prevalence of anxiety symptoms was 22%, and 18% of patients had both anxiety as well as depression. And after they controlled for all the usual medical potential confounding factors, and following the patients for 3 years, they found that those patients who had clinically significant anxiety also demonstrated an increased risk of hospitalization and an all-cause mortality in a dose-response manner. So the patients who had the most self-reported anxiety had the highest risk of hospitalization and mortality. Let's now discuss neurocognitive disorders. Neurocognitive disorders include cognitive impairment, dementia, and delirium, and we'll go through each one of these separately. So cognitive impairment encompasses a spectrum of persistent cognitive and functional deficits. It's a huge spectrum, can range from mild to severe, and they likely occur for many reasons, including medical problems. Uremia can make you confused. Poorly controlled diabetes with fluctuating sugars can affect your cognition, vascular disease, and other comorbidities. Now, mild cognitive impairment may affect someone's thinking and memory skills, but not so much that it significantly impacts their day-to-day life. I mean, they can still function independently, they can still maybe drive to dialysis, etc. In contrast, patients who have severe cognitive impairment that's associated with compromised ability to function, like an inability to perform ADLs. These people have dementia. So dementia is sort of on the end of the severe spectrum of cognitive impairment. Several studies in dialysis patients have indicated that cognitive impairment is a very common problem. Up to 70% of dialysis patients have some cognitive impairment. Study published by Wilson in 2018 reported that cognitive impairment was 3 to 5 times greater in the dialysis than in the general population. Murray in 2006 looked at 338 dialysis patients above the age of 55 or above, and they found that only 13% had no measurable cognitive impairment, 14% had mild impairment, 36% were moderately impaired, and 37% were severely impaired. That's a very common problem. The dialysis procedure itself appears to impact people's cognition, and this is demonstrated in a study that looked at how well people thought, the clarity of their thinking in relation to the timing of dialysis. Basically, they found it was worse during dialysis, and it was best just prior to dialysis and on the day in between dialysis sessions. Risk factors for cognitive impairment in the dialysis population include advanced age, depression, and basically having a whole bunch of medical conditions: heart disease, diabetes, high blood pressure, pulmonary disorders, those who have really large fluid shifts which necessitate removing a lot of fluid during treatment. Cognition tends to worsen over time. Drew published a study in 2017 of 314 hemodialysis patients with an average age of 63 years. Followed the patients for 2 years and found that every year their cognition worsened. It's unclear whether or not the presence of cognitive impairment differs between hemodialysis and peritoneal dialysis patients. In one meta-analysis of 42 observational studies, they found that the cognitive decline was comparable with both hemodialysis and peritoneal dialysis patients. Another study published in 2019 found that the risk of cognition impairment was actually greater in hemodialysis than peritoneal dialysis patients. Another large meta-analysis was published in 2016 that examined all the studies that looked at neuropsychological testing in dialysis patients. So there were a total of more than 3,500 participants. Mean age was 51 years, and they looked at different ways to assess cognition: global cognition, attention and orientation, concept formation, reasoning, construction, motor performance, executive function, language, memory, and perception. What they found that dialysis patients struggled with 2 facets of cognition: executive functioning, so basically how well they can complete tasks, as well as memory, so recollection. The presence of cognitive impairment among a dialysis patient is also associated with adverse consequences. Interestingly, as with anxiety disorders, those who have cognitive impairment also demonstrate an increased risk of being hospitalized and increased mortality. One study by Grieve in 2010 was a 7-year prospective study which assessed cognition in dialysis patients. What they found was that all-cause mortality was 2.5 times greater in dialysis patients with cognitive impairment than in unimpaired patients. So why does cognitive impairment affect physical performance, and why do they get hospitalized more often? Why they increase mortality? So one possible explanation is that cognitive deficits interfere with your ability to follow treatment recommendations, such as take your medications, and that may lead to suboptimal compliance. Alternatively, cognitive impairment may just reflect overall physical deterioration, say in someone who has advanced vascular disease. If a patient has severe cognitive impairment that significantly affects their day-to-day life, their activities of daily living, their overall performance, we consider them to have dementia. Common features of dementia include significant memory loss, confusion, personality changes, and other physical disabilities. Dialysis patients there are several different types of dementia, including Alzheimer's, vascular dementia, frontal lobe dementia, but probably the most common one among dialysis patients is vascular dementia. Dialysis patients have an increased risk of stroke compared with the general population, and they have multiple risk factors for vascular disease, including diabetes and high blood pressure. Dementia is very common in the dialysis population, affecting up to 20% of patients, depending on how long they've been on dialysis. The prevalence is twice that in the dialysis population than in the general population, and it increases over time in dialysis patients. One retrospective study in the United States, published in 2018, looked at dialysis patients aged 66 and older who did not have dementia at the start of dialysis. By 1 year, 5% had dementia. By 5 years, 15%. In 10 years, 20% had dementia. Another study that looked at dementia in the dialysis population was published using data from Taiwan in 2017. It was a 12-year retrospective database study, including both hemo and peritoneal dialysis patients who were matched to controls in the general population, who were essentially matched based on baseline characteristics and demographics. What they found was hemodialysis patients had a 64% greater chance of developing dementia than non-dialysis patients, and peritoneal dialysis patients had a 121% chance of greater chance of developing dementia than those who were not on dialysis. Most common forms of dementia were vascular and Alzheimer's disease, and risk factors for dementia in dialysis patients included older age, 75 and above, female sex, non-white race, and those who were institutionalized, say in a nursing home or other care setting. As with other neurologic and psychiatric disorders among the dialysis population, dementia is associated with adverse clinical outcomes, increased risk of hospitalization, increased risk of stopping dialysis, and also an increased risk of mortality, 2 to 3-fold higher risk. One study, for example, published in 2006 was a database study looked at large number of dialysis patients, including those with dementia at baseline, and those who had dementia had a 3-fold lower survival rate than those who did not have dementia. The diagnosis of dementia is sometimes hard to make in the dialysis population if you're not looking for it. A lot of times people have symptoms that are attributed to kidney failure or other medical problems or medication side effects. Therapeutic options are very limited. There are some medicines that are marginally helpful. The main management is essentially social support. If the cognitive impairment is temporary, often featuring confusion, disorientation, agitation, or hallucinations, we call it delirium, which is another form of neurocognitive disorder often seen in the dialysis population. It typically develops over a short period of time, usually hours to days, and is accompanied by additional cognitive impairment, such as memory deficits. And there are many potential causes. Drugs, for example, medications can accumulate due to the lack of renal excretion, infections, including pneumonia, bacteremia related to a catheter, hemodynamic instability, either hypo or hypertension, any sort of cerebrovascular disease, a stroke, hemorrhage, subdural hematoma, electrolyte disorders, hypoglycemia, severe hyperglycemia, hypocalcemia, nutritional deficiencies can cause delirium as well, and of course alcohol withdrawal and other substances. As with most mental health disorders, treatment for dialysis patients is largely supportive. You want to identify the underlying cause and address the underlying cause in order to facilitate resolution of the delirium. In addition, agitation and behavioral disturbances need to be managed to provide safe dialysis. Again, a shout out to our social workers who oftentimes address these issues. Let's now discuss some other mental health disorders that we sometimes see in dialysis patients. Schizophrenia is a psychiatric disorder that oftentimes features psychosis, and it's surprisingly common in dialysis patients. There's this one study that was published in 2008, looked at 70 dialysis patients who were assessed for schizophrenia and other psychotic disorders, and they found that the prevalence was around 10% compared to about 1% of the general population. A retrospective study of more than 100,000 patients between the ages of 22 and 64 who initiated dialysis were followed for the first year. 1% of the hospitalizations were for the diagnosis of schizophrenia. And interestingly, in non-dialysis patients, there was a retrospective study that looked at people who had schizophrenia and found that they were 60% more likely to have kidney problems, less likely to receive dialysis and or a transplant. Substance abuse and addictive disorders are also readily found in the dialysis population. In that same study we looked at of 70 dialysis patients who were assessed for various psychiatric problems. They found that 18% had an alcohol use disorder and 19% had another substance use disorder. Study published by Kimmel in 2019 looked at patients during their first year on dialysis and found that 1% of the hospitalizations of these patients were for an alcohol-related disorder and 1% were for another substance abuse. Sadly, suicide is more common in the dialysis population, occurring at twice the rate than in the general population. There was a study published in 2018 which identified 64,000 maintenance dialysis patients and found that during a 6-year period, suicide was twice as common in patients than in the general population. And independent predictors included the male sex, white or Asian race, recent hospitalization with a psychiatric disorder, and substance abuse. Right, time to summarize what we've learned today. Mental health disorders are very common in the dialysis population, occurring in up to 70% of patients. These include anxiety disorders, depression, neurocognitive disorders, and substance abuse. They can lead to poor adherence to dialysis and increased rates of hospitalization, suicide, and all-cause mortality. Major depression is the most common and most important mental health disorder among dialysis patients and would be addressed in a separate video. Anxiety disorders occur at a prevalence of 20 to 45%, much higher than the general population, also increases the risk of hospitalization and mortality. Cognitive impairment is common, affects attention, executive function, and language. If it's severe and affects activities of daily living, we call it dementia, the prevalence of which is twice that of the general population. Delirium, in contrast to dementia, is a short-term cognitive impairment that typically occurs secondary to another problem, such as medication, substance abuse, an infection, or some other medical illness or problem with dialysis. And finally, the moment you've all been waiting for, the monthly quiz. Question number 1, name 3 examples of mental health disorders commonly seen among dialysis patients. Excellent. Depression, anxiety, cognitive impairment, dementia, delirium, schizophrenia, and substance-induced mood disorders. Question number 2, name 3 potential problems associated with anxiety among dialysis patients. That's right. So impaired quality of life, increased risk of hospitalization, and increased mortality. Next question. What is the difference between delirium and dementia? That's right. So delirium, temporary cognitive impairment, usually secondary to some underlying problem, such as a medication or infection or some acute illness, with potential for the cognitive impairment to improve when the underlying problem resolves. Dementia is a permanent cognitive impairment which affects activities of daily living. What is the prevalence of alcohol use disorder among dialysis patients? Unfortunately, it is a staggering 20%. And final question, what percentage of dialysis patients have schizophrenia or another psychotic disorder? About 10%. So schizophrenics are more likely to develop kidney problems. They become dialysis patients, and it's a common problem that we see in our units. This concludes the September 2023 in-service for the Northwest Kidney Center. Thank you so much for listening. Thank you for taking wonderful care of our patients, particularly those who have mental health disorders. This is Andy Brokenborough signing out until next month. Have a great rest of your day.